Alright, so this is for the essay prompt 2 for the video final. So we're going to talk about the Wiggers diagram and how we can relate depolarization, muscle contraction, and pressure changes to each other. But let's start with the blood flow through the heart. So we have our heart here, right? We have our, oh my goodness, I just erased my heart. Our right atria, our right ventricle, our left atria, and then our left ventricle. So the blood flow is going to come through from the superior vena cava and the inferior vena cava into the right atria. 80% is going to passively fill into the right ventricle through the tricuspid valve. The remaining 20% is going to be active filling because the atria is going to contract and squeeze the rest of that blood down into the ventricle. So from there, the ventricle is then going to contract, and we're going to go through the pulmonary branch, through the pulmonary arteries, to the lungs, right, where it's going to pick up oxygen, and then we're going to go back through the pulmonary veins, and then we're going to go into the left atrium. Again, we're going to have an 80% passive fill into the ventricle. The remaining 20% is going to come from the atria contracting. So now that our blood is in the ventricle, we're going to go through the aortic valve, which is going to be right here. We're going to overcome that pressure to send our blood out the aorta as the ventricle contracts. And then from the aorta, we're going to go to arteries, arterioles, capillaries, venules, and veins. And then we're going to start all over again with the superior and inferior vena cavas. So that's our blood flow. So the way that this happens is through electricity, right? So this is an EKG, which shows the electrical signals that are responsible for the heart beating. So we have the P wave, which is going to be atrial depolarization, QRS, which is going to be ventricular depolarization, and then we have the T wave, which is going to be ventricular repolarization. So this is the Wiggers diagram. Looks super complicated, but it's actually not too bad when we break it down a little bit. So let's start with one section at a time. So we're going to start with atrial systole, which is going to be all of this right here. Okay, so when we think of systole, we want to think of contraction. So this is going to be atrial systole, so the atrias are going to contract, right? So we have this P wave, which I had said before was the depolarization of the atria. So the electrical signal is going to travel through the atria, so through here, and cause the atria to contract. Well, obviously on both sides because we have two atria. So we're going to see the atrial pressure increase right here, meaning that the atria contracted, which this makes sense because if we squeeze something like a water bottle, the pressure is going to increase and the water is going to want to leave. So we see the pressure increase right after the P wave. So here's our P wave, here's our increase. So it's a little bit right after. So when the atria contracts, the blood is going to go through the atrioventricular valves, the tricuspid and bicuspid valves, into the ventricles. So obviously that makes sense. The ventricular volume is going to increase because the ventricles are filling with blood. So we see ventricular volume increasing right there. So it also makes sense why we have a little bump in ventricular pressure there as well. So then our next stage is going to be isovolumetric contraction, which is going to be this section right here. So we have the QRS complex right here, which again is the depolarization of the ventricles. So the ventricles are going to contract. This is the beginning of the systole phase. So not just the atrial systole, but the systole phase of the heart. So where the ventricles are contracting. So during atrial contraction, we get a little bit of an increase in ventricular pressure because blood is rushing into the ventricles. So now that the ventricles are contracting, we have a much greater increase in the ventricular pressure, which that makes sense. So it's called the isovolumetric contraction. So isovolumetric means volume stays the same. So the amount of the volume in the ventricles stays the same because when the ventricles start contracting, all of the valves close. So now we have a sealed area that is contracting, which is going to give us a huge increase in the ventricular pressure. So that's the isovolumetric contraction phase. So the next we have the ejection phase, which is going to be this right here. So in the ejection phase, the aortic pressure on the other side of the aortic valve is around 80 millimeters of mercury. So say this is the aortic valve right here. This side of it's going to be 80 millimeters of mercury. So in order to push blood through the aortic valve, to open the aortic valve, we're going to need the ventricles. The pressure in the ventricles has to overcome the aortic pressure in order to open that aortic valve and eject blood to the rest of the body, which is what we want. So the ventricular volume is going to decrease as the blood leaves, and that's when we're going to see the peak in the ventricular pressure, right? Because we want the aortic valve to open. So that's actually when we see the aortic valve opens right there with that arrow, and the aortic pressure goes up. And the ventricular volume is going to decrease as the blood leaves the ventricle and goes out to the rest of the body. So the next phase is going to be isovolumetric relaxation. So again, isovolumetric, volume stays the same. So in this section, we have the T wave. So the T wave is ventricular repolarization, so our ventricles are going to relax, and we're going to start moving into the diastole phase of the heart, right, which diastole is relaxation. So the pressure in the ventricles are going to come back down, which we see right here. So we see that it steadily comes back down, the volume stays the same because it's isovolumetric. And then the aortic valve, all the valves are going to close, so we're going to see a little bit of an increase in the aortic pressure because the valves are closed. So once the ventricular pressure drops below the atrial pressure, that's when all the valves will open again, and then the whole process starts all over again. But again, the volume in the ventricles stays the same, but the pressure comes down as they relax. So how can we relate this to atherosclerosis? So atherosclerosis is going to be caused by, say this is our lumen, right? We have a lumen, and the intima is out here. So we have these things called small dense LDL particles. They're going to move through the lumen wall into the intima, and they're going to become oxidized small dense LDL particles, right? So then we're going to have these macrophages come through. They're going to roll and sniff. They're going to smell it. Then they're also going to move through. They're monocytes that turn into macrophages. They're going to come through and, they're going to sniff out that inflammation that's caused by the oxidized LDL coming through. And then it's going to absorb those. And so then we're going to get, say these are the small dense particles. Probably should use different colors. The macrophages are going to suck up those, and it's going to turn it into a foam cell. So then these foam cells are going to, let's erase part of this. They're going to build up right here, and there's going to be a whole lot of those. And that's going to cause plaque buildup underneath the lumen, and it's going to push it up so we have restricted blood flow, right? So that makes sense. So say we have atherosclerotic lesions in our aorta. So say here's our aorta, right? We have normal blood flow. It's good. Everything's flowing good. Then we do this, and let's show our lesions, right? So now blood flow is a little bit restricted. It's a little bit harder to get through here, right? So when you have atherosclerosis and you have those lesions, you're going to have high blood pressure, a reduced stroke volume, reduced blood flow, so you have a reduced amount of blood into the atria, reduced ventricular blood volume, because there's a plaque buildup in the aorta, which causes the higher aortic pressure, right? So if this aortic pressure is higher, if it's higher than the 80 millimeters that we talked about before, then that means your ventricular pressure has to work even harder to push back against the aortic pressure in order to eject the blood, right? So if we think about all of that, we have high blood pressure, right? So our ventricular pressure is going to be much higher. It might be all the way up here. Sorry, I have the wrong type of eraser on. Our ventricular pressure is going to be a lot higher, so it's working a lot harder. Higher blood pressure is not good for us. You're going to have a reduced stroke volume, reduced blood flow, so you're going to have a reduced amount of blood volume going into the aortas, which means you're going to have a lower amount of ventricular volume as well. So if your ventricular volume normally starts here, it might start down here and not go up as much, and so this whole line might be smaller, which isn't good because you're going to reduce your ejection fraction because not as much blood is being pumped out, which can lead to a lot of complications, including like heart failure. So pharmaceutical drugs we can use to combat this, to kind of fix our Weger's diagram here. Atherosclerosis is treated a lot with ACE inhibitors, beta blockers, and calcium channel blockers because they lower blood pressure by relaxing the blood vessels, causing vasodilation. So if we have this here, right? So if we relax and vasodilate our vessels, we're going to have way more room for the blood to go here. So all those problems we talked about will be just a little bit less problematic, because we'll have vasodilation. It's going to allow more blood to flow freely into the heart. Beta blockers also cause the heart to beat slower with less force, so there's more time for filling, so we increase the ejection fraction. So we'll have more time for the ventricular pressure or ventricular volume to increase some, which means our ejection fraction will improve. So overall, we talked about the blood flow through the heart, what the EKG is, our Wiggers diagram, and how all the pressures and contractions and depolarizations and repolarizations, how it all relates to each other, and then what atherosclerosis is and how we treat it and how it changes Wiggers diagram. So, thank you.